All right, so now we're going to talk about valve disease. And if you are paying attention, some of these things we talk about can actually be effects of or complications of some of the other processes we've already discussed, right? So valve disease is stenosis or weakening of a valve. So either the valve gets stiff and blood can't get through it, or it gets weak and floppy, and when the blood can go backward through it, can regurgitate through it. Stenosis restricts outflow and incompetence allows regurgitation, and the symptoms depend on which valve. So let's look at the heart valves first. Okay, so let's look at the heart valves. We have the right atrium, right ventricle. The valve between those is the tricuspid valve. Okay, so if the tricuspid valve is stenosed, stiff, that means we have a hard time getting blood from the right atrium to the right ventricle, which is going to mean we have a hard time getting blood to the lungs to be oxygenated, right? If it's floppy, that means that whenever the ventricle contracts, some blood will go to the heart, some blood will back up. So we may have some right side failure. Left atrium, we come back from the lungs, left atrium, left ventricle, that valve is the mitral valve. Sorry, I'm looking at the aortic. That valve is the mitral valve. If the mitral valve is stenosed, if it's stiff, we have a hard time getting blood from the right atrium or the left atrium to the left ventricle, which means we have less blood to go out to through the aorta, but also that's going to put some back pressure on those pulmonary veins and the pulmonary vessels. So heart failure, left side heart failure, pulmonary edema, and also not as much blood going out to circulation, right? If it's floppy, then whenever the ventricle contracts, some blood is going to go through the aorta, but some of it's going to go back through that floppy valve. Now, those floppy valves also leave room for blood to pool and sit and clot. So we have some other risk along with this as well. And if we've got diseased valves, they're either stiff or they're floppy, then that's a place where bacteria can collect. Okay. The most common we're going to see is mitral valve. So I want you to look at this, and we've already talked about aortic and pulmonic stenosis, right? If these valves going to the big arteries are stiff, we're going to have a hard time getting blood flow either to the lungs, if it's the pulmonic valve, or to the body, if it's the aortic valve, right? So we're going to look at the tricuspid and the mitral valves. If we have tricuspid atresia or tricuspid stenosis, atrium contracts, has a hard time getting blood down to the ventricle, hard time getting blood to the lungs for oxygenation. If we have tricuspid prolapse, left atrium contracts, blood goes to the left ventricle contracts, some blood goes to the lungs, some blood goes backward. Okay. So where does that extra blood go? Into systemic circulation. So we're more likely to have right side heart failure with swelling. Okay. Now, left side, right, our left atrium contracts. If this valve is stiff and we can't get blood through, we have less blood going out to the body. That's stenosis. Less blood going to the body. Where's it going? Backing up into pulmonary circulation, pulmonary edema. If it's floppy, okay, right, left atrium contracts, goes to the left ventricle contracts. Some blood goes through the aorta and some washes back into the left atrium. Again, some pulmonary edema, but also more risk for clots. Okay. So when we're looking at valve disease, we're looking at, which valve is it? Is it stiff or is it incompetent? Is it weak? These can be congenital or acquired, and you've already learned a couple of the possible ways we can acquire those stiff valves, right? Or those floppy valves. The complications, heart failure, because if blood can't go forward, it backs up. Blood clots, because blood that doesn't move well starts to clot, and endocarditis, because those valves themselves are a place where bacteria can collect. Medical management for these, the patient, if it's symptomatic, will have meds to manage their symptoms and prevent complications. If it's mild, it may not be symptomatic, so they may just monitor. But if it's symptomatic, then they have meds to manage their symptoms and prevent complications. If it's severe, the valve may need to be replaced or repaired. Nursing care, we need to do lots of teaching. We need to make sure that all providers are aware that that patient has valve disease, and we need to know whether the patient requires prophylactic antibiotics before any procedures. Okay, the next two sections are going to be about major manifestations of heart disease.